Welcome to What's Your St. John's Story, a 30-minute segment sponsored by St. John's United, highlighting connectivity within our community through storytelling. I'm Rachel Simonson with the St. John's Foundation, and today we're talking about wellness at St. John's United. And we're talking about wellness with Jan Ostermiller, who's our Director of Wellness Coordinator at St. John's, and Andrea Bouchard, who's our Ridge Resident Liaison, focusing on employee wellness with Jan and resident wellness with Andrea. Well, welcome.
Thank you.
Thank you.
I'll start with you, Jan. Introduce yourself. How did you find St. John's? I know it's quite a long road, winding road, but tell us what you do now.
Absolutely. Well, I'll give you the abbreviated windy road. I started at St. John's in high school. I was a dietary aide, so I worked in the kitchen. And, through a number of different areas, I worked as a nurse's aide, got myself through college. And then I was lucky enough to return to St. John's as a nurse practitioner and a provider for St. Vincent Healthcare. And now my most recent experience or exposure to St. John's, I started in October of 2021 as the wellness coordinator for our employees as well as for our residents.
Wonderful. Thank you for sharing that. We'll explore more about what that means in just a minute, but I want to give Andrea a chance to introduce yourself.
You bet. Yeah, so I am Andrea Bouchard. I am what they call the resident liaison out at Mission Ridge in the Vista on St. John's campus. And a lot of people ask me, what is liaison? I kind of summarize it as I'm an advocate for our residents. I help out with the transitions in and out of independent living and assisted living. I'm also a good resource for third-party services, just really helping our residents get their needs met, whether it be through referrals, therapy, and those sorts of things. So,
and you are an RN.
I am a registered nurse, and you bet. My kind of unofficial role is case manager, and so I also help out with hospitalizations, following our residents through that trajectory, and just make sure that they have a good, safe plan in place when they come home.
Fantastic.
Yeah.
And some of that with the residents staying out of the hospital falls under your realm now, Jan. Tell us what you're doing with the employee and the resident health clinic.
Well, as many people know, there's a number of challenges facing healthcare today. First of all, there's a huge healthcare workforce shortage, and we're all experiencing that now, and I'm sure well into the future. There's a finite amount of resources to spend on healthcare, and our patients are becoming more. They're utilizing healthcare more, and their illnesses are much more acute, much more complicated, and so there's a lot of things that we're addressing. So as far as the healthcare workforce shortage, we really want to keep our employees healthy. And so our wellness program is really centered on meeting the needs of our employees, both mentally and physically, providing mental health care. A lot of our employees experience, especially the last 2 years, a huge amount of stress and uncertainty in terms of what their job entails and their children in schools and with COVID. So addressing mental health care is a huge aspect of what we're doing. And then, of course, our community health is not really where we want it to be. So we're addressing obesity and diabetes management, hypertension, all of those things that are most workforces are experiencing, as well as long-term COVID symptoms and those things. So keeping our workforce healthy is top priority. In addition to that, we're looking at implementing wellness programs for our residents, working on keeping them out of the hospital. We want to provide acute care services that we can really intervene early before they need to take a visit to the emergency room or be hospitalized for their chronic, exacerbation of their diseases. That's really important to us. And so working with Andrea in that aspect has been really wonderful.
Yeah. such an important thing to think about, especially in terms of the employees, because if our employees aren't well, they can't take care of our residents very well. And so it goes full circle
Absolutely.
to making sure that everybody is focused on being the best they can be at every moment of the day.
Absolutely.
For our residents.
For sure.
Andrea, how long have you been at Mission Ridge?
So I have been at Mission Ridge in the Vista a little over about 6.5 years.
And for people who aren't necessarily as schooled as we are on Mission Ridge in the Vista, Mission Ridge is independent living.
Yep.
And describe for me what independent living looks like, and then the Vista is assisted living. Describe for us what that looks like.
You bet. So Mission Ridge is our independent living. It's 120 apartments, so it's a very large building. Filled with lots of wonderful residents that oftentimes are just at a point in their life where they're wanting to maybe not have to cook as much. They're aging, and maybe their priorities are, just spending more time with their families. They come in. There's, folks. There's maintenance on staff. There's folks to cook for them and just kind of make that stage a little bit easier. In terms of the assisted living, there's 60 apartments over there, and folks are often either transitioning from our independent living, where maybe they just need a little bit of extra help. They might need medication management. They might need 3 meals a day. Just their needs are such that they're just at that point where it's good to have more support around them.
Yes, and thank you for sharing that. I think there's a lot of confusion sometimes that Mission Ridge is assisted living.
Absolutely.
But no, those are folks who are living the dream, the cruise ship on
You
land
bet.
activities.
Yep.
And then as they age
Yep.
and need more assistance, then
Absolutely.
they can transition over when the
You
time
bet,
is right.
yeah.
And we'll talk a little bit
Yeah.
about that transition
Yeah.
in just a few minutes.
Yeah.
But Jan, talk a little bit about the programs for employees that you are implementing.
Absolutely. So one thing that we've initiated is every year we have an employee wellness screening where employees go and get their vitals, their blood pressure, height and weight, BMI, as well as a number of labs drawn. And with that, we're offering services for our employees to come in and go over those labs and discuss what they mean and look at early indicators of, say, prediabetes or borderline hypertension, and really working on interventions that we can do now that can really prevent the long-term ill effects of those diseases if they're not managed properly or prevented. Mm-hmm. So that's very exciting. We have an acute care clinic as well. So if our employees have a sore throat and they, want to get tested for strep throat or have, concerns of COVID or influenza, we can test them for those things. We can treat their illnesses in that respect. So that's been really helpful. I think it's really important in getting our employee population well so that they can return to work as soon as possible, as well as prevent the spread of those illnesses to our residents. So
Absolutely. Well, and it's such a time saver, too, for the employee to just drop by your office rather than having to take an entire day off, practically, to go sit in a
Absolutely.
waiting room at the clinic.
Yeah, and one thing I'm hearing often from our employees is how difficult it is for them to get into their primary care provider. When we talk about a finite amount of resources for healthcare, we're not only talking about financial resources, and the workforce shortage extends to primary care providers. And so if we can make that convenient for them and encourage them to see their primary care or come and get those problems addressed early, we can prevent a lot of future health problems.
And have we been able to extend that care option for families of our staff members?
Absolutely, that's definitely a service.
So
I've
again,
seen children
kids.
of I've seen children of staff members for different acute illnesses, things that they catch at daycare
Sure.
or school. Yeah,
But again, it takes a day off, and many people can't afford a day off.
100%. Yep, and you're not guaranteed a convenient time to do that either.
Correct.
So
Right. Well, those are wonderful programs. I can attest to the in screening. It caught a little thing that I had very easily managed,
Right.
but I wouldn't have known had I not had the employee screening.
Yeah.
So that was a big benefit to me.
Absolutely.
So I'm glad for that program. Back to Andrea and the residents. Some of the things that Jan is doing in her clinic are designed to help keep our residents healthy and out of the ER, out of the hospital. I understand that we're at the top of the list for number of calls with the ambulance crew at Mission Ridge. Is that accurate?
Yeah, we have a large population of aging adults, and so that's an inherent reality. I think that one of the things that Jan has kind of mentioned is we make it it's kind of our campus priority to really help during this pandemic and all other times just to help minimize the burden on the healthcare system and really just meet the needs of our residents. And oftentimes they're, not wanting to go into the emergency room, and so we're working directly with their primary care, and we're kind of looking at more creative alternatives to how can we still meet their needs and still address their issues, but not disrupt them so much, and it just kind of helps the whole system. And so we've definitely had some opportunities to do that, and I think that's a priority for most organizations, just recognizing the changing dynamic. And so I do think that it's a wonderful service, and the residents are receiving that very well. And we certainly work directly with their primary care, and it just is a huge benefit, I think, overall.
Yeah, a lot of times those chronic illnesses can cause lightheadedness, which causes a fall, which then causes the ambulance to come. And then even if they return home the same day, it's still disruptive. And if you can manage that better, it saves time and money and stress and further injury. So these are all benefits to our residents as well as our staff. But when things happen, which naturally happens as we age, Andrea, talk a little bit about making those transitions and helping residents and their families understand that it is time for additional levels of care.
You bet, yeah. So again, with working with an aging population, it's oftentimes that residents will come in maybe doing independent living, or and their needs are progressing, and so it's a lot of just. I say it kind of lovingly hand-holding for the families. Oftentimes those transitions are a bit of a grieving period. I think that we do it very well on our campus, and it's a wonderful service that we provide, but it's a change, and it's, kind of a lot, they fear that as a loss in independence. And so it's a lot of communications with the families, a lot of communications with the resident themselves, and, with their providers, just really to help make that as seamless as possible.
Yeah. Almost everybody desires to age and die right in the place that they call home.
Yep.
But sometimes it just is not possible.
Yeah. Yep.
And more often than not, if there's a spouse, part of that transition to a different location is really about preserving the spouse's independence.
Absolutely. Yep.
Yeah. So, and we have options on our campus.
We do.
We've got the assisted living, and when the time comes, if they need to go to more skilled levels of care, we've got cottages. I'm going to talk a little bit, either one of you, about our cottage setting and what that's like.
Yeah. So surprisingly, I was part of the planning committee of the cottages back in the 90s, in the late 90s. And so that was quite an experience, because really it was, the goal was to change the institutionalization of nursing homes and really provide an environment that was a home to our residents. And I think St. John's has successfully put that into place. I think that the employees who work there enjoy it very much, and they enjoy caring for the residents in an environment that's safe and comfortable, and really and meets the needs of those folks living there. It also provides a wonderful environment for families to come and visit, including spouses who, and many of our couples on campus, over the years, I'm sure, are afforded the opportunity to live in an independent living area and walk across the street to see their loved one, their spouse in our cottages, which is a wonderful experience.
It is to be that close. And
Absolutely.
keep that watchful eye
Yes.
without having to drive across town.
Exactly. Exactly. Yeah. And I'm a strong believer that although we are healthcare providers, healthcare is provided by everyone, including families, and they play a very important role in helping us to do our job the best that we can.
Absolutely. Yep.
So we like to have them close.
Good. Well, we're coming up at the point in this conversation where I'd like to ask each of you to reflect on what you think makes St. John's a special place. Jan, you've come and gone a couple of times. Andrea, it's been 9 years.
6.5.
6.5. I thought you said, I'm not paying much attention, not listening very well.
It will be 9 years
Six
before we
and a
know
half
it.
years.
Yeah.
But I'm going to start with you, Andrea.
Yeah.
What do you think makes St. John's special? What attracted you to St. John's?
I think definitely the community. It's got such a community feel. It's been a resource to our greater community for as long as I can remember. I have had some wonderful, feelings of, having family members there, and it's just been just wonderful with the concerts and I had my mother-in-law there at St. John's, and my daughter, has gone to campus in the daycare there at Center for Generations, and I just really think it's a community. It's it's a place where you feel the mission at work each and every day, and I think that's really huge. And I consider it a blessing for that reason. I mean, I think it's a wonderful place. So.
And you've had family member served by St. John's.
Absolutely.
Yeah.
Yep.
So.
Yeah, and we've kind of been through the continuum, started, start to finish, independent living to assisted living to memory care, and then skilled memory care. And so we've had kind of that unique opportunity, and I think a very humbling opportunity to kind of walk through that. I think that gives you a really, kind of drives you, as a healthcare provider, to know what you want for your patients, and you've been in those shoes, and so I think that's really been a blessing.
Yeah, that's good.
Yeah.
Jan, what does St. John's mean to you, and what makes you so attracted to St. John's?
Yeah. Well, I will say I keep coming back, and so so I think that's a very important statement. But I've never worked in a place that truly lives the mission like St. John's does, and this opportunity, most recently, has really afforded me the opportunity to take care of patients across the continuum, truly from birth to death in the environment that they work and live. And I don't think there are many people who get that opportunity. It's a beautiful way to provide care.
Yeah, absolutely.
So it's truly a family. And I think that's what I love about St. John's.
Good. Let's come back to the workforce shortage, because everything that we've been talking about, mainly for the employees, really is about attracting and retaining our employees and then building up a strong workforce, strong and healthy workforce. Speak to that a little bit, if you would.
Yeah, so, I think a lot of it is, finding different ways to provide care more efficiently, using, leveraging our resources. But as we spoke earlier, keeping the workforce that we have healthy, but also actively recruiting people and selling St. John's to people. It truly is a place where people may not, break the, they may not make the most money at St. John's, but it truly is a place where people can grow and flourish and, provide care that they feel good about. And I think that's what we really are going to use. And that's what we've used in the past to recruit excellent employees and continue to provide excellent care for our residents.
Absolutely. What are your thoughts on that, Andrea?
I definitely think that St. John's gives the opportunity for work-life balance. I think there are very few jobs, if not really any, that doesn't give that opportunity. I think that's huge. I think the pandemic has kind of showed us that more than ever. I think that we have a lot of we have staff that come in as personal care attendants. They come in as CNAs. They're going to school. They've got a family at home. They might be taking care of their parents. So it just it's something that is very employee friendly. And probably with the employee wellness, it's just very conducive to work-life balance. I think that's huge. And I think it's hard to get bored there because there's so many different moving pieces and so many opportunities. We have a lot of folks that will transfer internally, and so I think it just kind of checks a lot of those boxes for younger staff as well as staff that are older and just wanting to have have more time too. So I think there's just a lot of really good opportunities there.
Yes. Yeah. And I suspect that organizations like St. John's, healthcare organizations, and maybe other corporations as well, will start thinking about employee wellness as an attraction and retention tool every bit as much as a retirement plan.
Absolutely. Yeah.
Yeah. All right. Well, in our remaining minutes, I'm going to ask you two to reflect on this question that I ask everybody. If I were to just run into you out in the community and said to you, what's your St. John's story? Jan, how would you respond?
Oh boy. I would say that considering St. John's my family, that my St. John's story is that I want to provide the best quality care for our employees and residents as possible.
Wonderful. And Andrea, what is your St. John's story?
I think that my story is, definitely to be a blessing to my residents and to help them walk through the stages. I just see it, my early days as St. John's, I've loved the community for years, decades really, and I consider that very much a gift to be able to help out through those stages, and so definitely it's been a good thing, and my personal mission is just to help make people's lives just a little bit better and a little bit easier. Going through some necessary stuff and some kind of some normal stages. So,
Well, and you both are so good at what you do, and you're such assets to St. John's that you are part of what makes St. John's a treasure in this community. So, thank you for what you do. Thank you for sharing your stories of wellness today. And that has been another segment of What's Your St. John's Story? We hope that you will join us the next time. Thanks for watching.
For generations, St. John's has united us with its uplifting vision and lives it has touched. There are thousands of stories about St. John's. Prayers answered for a long-awaited adoption, pain-free relief after healing from injury, settling into a new home for the next phase of life, the comfort of compassionate end-of-life care, the joy that comes from volunteering, and at-home help that supports the fullest life. At St. John's, we are creating community and bringing families together. We offer many services for home, health, and family, from childcare, support for an unplanned pregnancy, and physical therapy, to home health care, senior living services, and hospice care. For all times of life, we are here for you. The heartwarming stories of St. John's are woven into the fabric of our community. What's your St. John's story?